The name of this prokinetic and antiemetic is Reglan, which has the generic name of metoclopramide hydrochloride. Reglan is typically supplied 5 mg per milliliter in vials of 2 milliliters or 10 milligrams. Reglan is thought to be a dopamine type 2 receptor antagonist, primarily in the gastrointestinal tract, but at larger doses in the brain as well. In the gastrointestinal tract, dopamine type 2 receptors are GI-coupled protein receptors on the smooth muscle. When activated, they reduce smooth muscle contractions by hyperpolarizing the myocytes along the GI tract. When Reglan is administered, there is a competitive antagonism of the dopamine type 2 receptors, which now promotes cholinergic stimulation along the GI tract, increasing gastrointestinal motility and promoting gastric emptying. These effects also increase lower esophageal sphincter tone and relax pyloric sphincter tone while increasing gastric, duodenum, and jejunum motility without increasing colon or gallbladder motility. In large doses, Reglan blocks dopamine receptors and serotonin 5-HT3 receptors in the medullary chemoreceptor trigger zone, attenuating nausea and vomiting. Dopamine 2 receptors are normally activated by dopamine, which then activates a GI-coupled protein receptor. This then in turn activates an outward rectifying potassium channel, allowing potassium to flow out of the cell into the extracellular space. This leads to a hyperpolarization of the cell, leading to decreased activity of the myocyte. When Reglan is given, it competitively inhibits the dopamine type 2 receptor, which is a GI-coupled protein receptor, not allowing the dopamine to have its action. This in turn inhibits the outward rectifying potassium channel, allowing the myocyte to depolarize normally. Reglan is typically given intravenously for anesthetic administration. However, it can also be administered PO and IM. The dosing for Reglan is 5 to 20 milligrams IV, and generally a dose of 10 milligrams in adults is used to aid in gastric emptying for rapid sequence intubation for a patient with full stomach precautions, or 10 milligrams 30 minutes prior to the end of surgery to attenuate postoperative nausea and vomiting. The onset of Reglan is 1 to 3 minutes when given intravenously. When given intramuscularly, the onset is 10 to 15 minutes, and the onset is 30 to 60 minutes when given orally. The T-half alpha of Reglan is 1 to 3 hours after administration, depending on the clinical effect and dose given, with higher effects having longer lasting effects on lower esophageal sphincter tone and gastrointestinal motility. The T-half beta is 5 to 6 hours with normal hepatic and renal function. Reglan is metabolized through hepatic mechanisms and is also cleared through renal clearance. There have been studies showing an increased T-half beta with impaired renal function. Reglan is useful for the prevention of postoperative nausea and vomiting by antagonizing dopamine 2 and serotonin 5-HT3 receptors in the chemo trigger zone of the brain. Generally, it is given 30 minutes before the end of surgery to have the greatest effect at attenuating these symptoms. It's also used for RSI in patients with full stomachs. It increases lower esophageal sphincter tone, increases gastric motility, and promotes gastric emptying. Some anesthetic concerns for the administration of Reglan are lowering the dose for patients with renal impairment, and if your patient has hepatic or renal impairment, understanding that the metabolism will be slower and the duration of action of the drug will be longer. At higher doses, it can also cause sedation and dystonic reactions. This is also seen at lower doses with children who are at higher risk for such reactions. Here are some interesting links about Reglan.